Pleasant good morning to our Sky family of 99.5 FM. And I would also like to say a pleasant good morning to our social media platform as well. A person that is tuned in at this time on our Facebook Live, our Instagram Live, TikTok, as well as our YouTube as well. My name is Stephan Vialva. I'm a senior consultant and blood microscopist at Batson Associates. I'm also a certified phlebotomist and medical laboratory assistant. So I have some topics as I want to share with you this morning. And some of those topics as it relates to poor gastrointestinal health, as it relates to leaky gut, kidney stones. I also want to talk about posture as it relates to headaches as well, and also as it relates to using antibiotics and candida and poor gut microbiome health. So firstly, let us start off with poor gastrointestinal health. So your gastrointestinal system, I will say, is the second most important system in the organ systems of the human body. And the reason for that is because the brain holds number one as it controls the entire body and its functions from a neurological perspective and so forth. But the importance of the gastrointestinal system lies because without proper nutrition absorbed, the rest of organs cannot function properly. So the heart cannot function properly without certain nutrients in terms of enzymes. The brain cannot function properly without proper cholesterol being produced and proper glucose being used to allow the brain to perform on a day-to-day basis. And actually, that is why persons feel hungry, because the body doesn't only need the nutritional aspect as it relates to, getting that level of nutrients for the body to function, but also for the brain to perform. So anytime we feel hungry, especially if you're a person that eating a lot of high carbohydrate food and using a lot of refined sugars, you tend to feel hungry very quickly because the glucose there is not maintaining, all right, or keeping the brain active for that long. So it keeps burning out very quickly and the body will notify you that it needs more glucose to perform. So this is why you always want to consume more complex carbohydrates, things like your provisions, all right? So the sugars will actually be slow releasing into the bloodstream and not burn very quickly, so that you have to feel hungry very often, because that can cause you to gain weight. And the more refined sugars that you use will secrete insulin, and that will cause fat to develop on the body very quickly as well. All right. Now, in addition to that, there are some habitual patterns that persons have challenges with. And most persons, sometimes it's very challenging for them to make that change as it relates to those habitual patterns. And those habitual patterns are actually things like eating and drinking at the same time, eating your foods very quickly, and not eating on time. Now, a lot of persons have issues with eating on time because because of their jobs. If it's a shift time job, especially, they tend to not eat properly. All right. And by not eating properly, you will start to lose mass on the body as well. So not only muscularity will lose, but you also lose adipose tissue, which is the fatty tissue. So you don't have a fit look, but then you start getting very slender in size. And that is very unhealthy for the human body as well. Because as much as you don't want to develop any high level of visceral fat and adipose tissue, fat has to be present to keep the body warm and also to maintain proper functionality of the body in certain areas. All right. So everything in the human body have its purpose, but it has to be within balance and range for the body to function optimally as well. All right. So what I always tell persons to do as it relates to having a shift time job and not having the ability to eat on time, I would mention to persons to at least have some fruits with them, or if they can have like some nuts and grains to maintain their protein intake. So in the event, on a little quick break, even if it's like a 10 minutes, they can have those there to keep them up until they can have their solid meal, so that they don't have or stay on an empty stomach for that long, all right, to develop any high concentration of hydrochloric acids and so forth as well. All right, so that is just a little tip of advice that persons could use to not stay hungry as it relates to their job, because it could be beyond their control at times. All right. Now, in addition to that, eating and drinking at the same time. And this is very, very common throughout the world. Now, some persons would mention to me, as it relates to dealing with persons on a day-to-day basis, doing consultations and blood tests and all of these things, they will mention to me that they would have challenges because they tend to feel like they're choking if they aren't eating and drinking at the same time. And the reason for that is because the body is adapting to that situation. So if you were doing something for a lengthy period of time, the body will adapt. Okay. So what you have to do is try to minimize the intake of liquids while eating, and the body will then reverse that condition, and you will not feel to have any liquids when eating as well. All right. So it's something you can't stop just like that. You have to take it gradually. All right. So what I actually tell persons as well is to start, instead of eating and drinking right away, at least give your body a little 20 minutes, half an hour, or so forth, and start to wean in so that you can make that adjustment going forward there as well. Because you see, when you eat and drink at the same time, what is going to happen is that the concentration of the hydrochloric acid is going to dilute when you add liquids to that solution, and the acids will not have the ability to break down the foods effectively. So you lose nutrition from those undigested foods. All right, your proteins, which is amino acids, will not be absorbed properly, and that will cause a lot of complications with your muscles and many other functions as it relates to proteins in the body. All right. Your minerals, your vitamins, all of these things will not be absorbed properly. So you'll have issues with your nervous system. You will have issues with the kidneys, all right, in terms of proper electrolyte balances and all of these things from a mineral perspective. And minerals are actually more important than vitamins in terms of absorption, because without proper mineral absorption, you can't absorb vitamins properly. So this is how imperative it is as it relates to not eating and drinking at the same time. Okay. So you could have water room temperature at half an hour before your meals, and you can also have it an hour after your meals. All right. But for persons who are, as it relates to that habitual pattern, you can actually start doing like half an hour. All right. Just a little bit of water. All right. Until the body has gradually adapted, and you can stay an entire hour without drinking anything while eating. All right. Eating your foods very quickly as well is another factor of gastrointestinal issues. The reason for this is because digestion starts in the mouth first. And if you don't masticate or chew your foods properly, the particles of the food is going to go into the stomach in larger pieces. And it's hard for the stomach to churn and break down those pieces of food molecules. So you tend to not have the amount of absorption taking place. So you will absorb some of the nutrition, but not everything. And that can also cause a deficiency there as well. All right. So, and especially for persons that are elderly, they tend to have challenges with proper mastication due to not having the amount of teeth that is supposed to have to chew and masticate the food properly as well. So in that case, what persons could do, well, for the elderly class, so it's persons who have issues with their dental hygiene and so forth, they can start crushing the food instead. So you want to drink a lot of smoothies and nutrient-dense smoothies, things like oatmeal, your bananas, flax seeds, your chia seeds. You can add a little bit of cinnamon there, some nutmeg for flavor, which is also anti-inflammatory as well. All right. You can use almond milk, of course. You want to use nut milk instead of any dairy milk like cow's milk and so forth. And you can have a smoothie there that is nutrient dense. So you will have proper absorption taking place there. In addition to that, if you're having any provisions, like sweet potatoes, cassavas, and so forth, you boil them very soft. You can crush your sweet potatoes. Sweet potatoes are actually very high in fiber as well. So you tend to get a lot of roughage there as it relates to your bowel movements. It also feeds the good flora in the stomach, which I will go forward with and explain what that is, to maintain proper colony forming units there as well, for proper absorption and also for proper immune functionalities as well. All right. So going forward, as it relates to your gut microbiome, and what gut microbiome actually is your good, healthy flora in the digestive tract. So these bacteria are like policemen in the digestive tract. And without those bacteria, a lot of issues will arise, not only internal, but externally as well. Because you see, the integumentary system, which is the skin, has a lot of good bacteria on the surface of our skin. Because everything around us, our home, our TV controls, our phones, everything, it is filled with microorganisms and bad bacteria as well. And the only thing that is protecting us from an external perspective, which is our innate immunity, is those good, healthy bacteria. And if we matters not how much you bathe and how much you soap and all of these things, you could never get rid of those bacteria just like that because they belong to the human body. Okay, they actually keeps us alive. All right. For example, if a person is doing dishes and they tend to use a lot of harmful chemicals to do like dishwashing liquids and all of these things that isn't agreeing with that person's skin, and it kills the good bacteria in the stomach, sorry, on the surface of the skin, that can cause dermatitis to arise. So you tend to get inflammation in that area, and inflammation is there to notify and tell you that something is wrong. So the area starts to get a lot of pus, all right? It becomes very inflamed, so pain is inflicted, it becomes swollen, it becomes tender, and all of these things as well. So to prevent those things, what I also tell persons to do is to wear gloves while doing your dishes, especially if you have a lot of sensitivity to the skin, to prevent those issues from occurring as well. All right. From an internal perspective, one of the things that I would highly recommend is probiotics. Now, there's different brands of probiotics. And when it comes to Batson and Associates, what we do is we are specialized in giving persons the correct advice as to what they should be using, because we are very brand specific and we would recommend proper brands to persons. We recommend proper diet for persons as well, tailored based on the issues that they are having as well. So for example, let's just say if someone comes in with a kidney problem or, well, renal issue, all right, we tend to recommend a kidney diet for them, which is low potassium, as compared to a generalized diet for someone who just wants to maintain proper health and wellness, okay? Because potassium is something that damages the kidneys, and you have to actually use foods that are lower on the potassium list, because all foods have potassium, but you have to sift out and know which ones to consume, so the kidneys will then have the ability to regenerate itself properly, all right? With that guidance there from us as well. Now, before I go forward, I just want to call out some of the contact numbers for you all. Our Shogunas, and we actually have 4 branch locations, and our Shogunas contact is 222-8261. That's 222-8261. And our Shogunas office is located on the 2nd floor of Money Talks building in Montreux, Shogunas. Our Debe contact is 223-7515. That's 223-7515. And our Debe office is located on the corner from Samud Street and the SS Erin Main Road. Our St. James office is located on the main road of St. James in the Red Edge Mall. And the contact is 220-8113. That's 220-8113. And of course, our Tobago branch is located in Scarborough, Tobago, in the Triangle Building. And the contact there is 226-4553. That's 226-4553. All right, so this is supporting health naturally. Again, my name is Stephan Vialva, senior consultant and blood microscopist. I'm also a certified phlebotomist and medical laboratory assistant. All right. As it relates to some of the services that we provide at Batson Associates, so we actually, one of our most important service that we offer is our live blood analysis. And the live blood analysis is actually where we take a capillary sample of blood from the finger, and we will then use that blood under the microscope so persons could see their cells from a microscopic perspective. So they can then see if they have any circulation issues arising. They can also see if there's any stressing of the organs, the kidneys, the liver. Also, if you have any bacteria or microorganisms in the bloodstream as well. Gluten, which is something I will touch on going forward as well, which actually causes gastrointestinal issues as well. All right. Those are things that we could see, and also hormonal issues, etc., as it relates to a female in terms of polycystic ovaries, fibroid, as well as prostate issues if a male has that issue as well. The thing is, we could also pick up hormonal issues due to stress. Stress affects the hormones negatively. Now, depending on the quantity that we may see, we can then make our judgment there as it relates to recommendation. Or if we see a lot in quantity, we will then send persons to do specific laboratory tests like FSH and LH. We may send them to do things like ultrasounds to see if there's any progressing fibroid, or if they have fibroids, to see the progression there in that particular area compared to the time that they would have done the last test. All right. So for guys or men, PSA tests and ultrasounds as well to see if the prostate has any major enlargement or how high the PSA readings could be as well. All right. So as it relates again to the gut microbiome from an internal perspective, again, as mentioned before, is like the policemen in the gut. All right. And without their presence, what tends to happen is that other pathogens like Candida, and Candida is actually a fungi. It belongs in the digestive tract of all human beings. But with that imbalance, due to the lack of gut microbiome, it tends to enter into the bloodstream, which is where it causes a lot of issues. And some of those issues might be things like dandruff. Persons could get things like tinea vesicular, which is Lota, all right, commonly known in the Caribbean, which is where you tend to have a lot of patches on the skin due to lack of melanin production. So some areas of the skin might be very dark in color. Some areas is very lightly shaded in color, all right? And for persons who reside in the tropics, they tend to progress faster due to moisture and sweating consistently. So areas like the armpits, on the tummy area, on the back, closer to the chest area, those are areas, or even the face. Sometimes if a person sweats a lot, you tend to have Lota in those areas as well. But the root cause is Candida albicans, all right? And there is 100 different types of Candida, but albicans is actually one of the most common that causes a lot of issue. So dandruff, for persons who have dandruff, actually, what dandruff is that there's a particular fungus in the hair, all right, caused by Candida that feeds on the sebum in the hair. And our hair is actually one of the most greasiest or moist area on our body, all right? In addition to what we would put in the hair naturally has a lot of oils, all right? And the reason for that is because of lubrication for the hair follicle or the shaft of the hair to protrude externally for hair growth. But you see, when Candida enters the hair, it tends to feed on the sebum, and lack of lubrication in that area can cause the hair follicles to not grow properly. And this is why persons who have dandruff, it tends to have patched areas in the hair, all right? So some areas might be normal, some areas may not grow properly, and so forth because of that issue, all right? Now, inflammation, which is a chemical that belongs in the human body to tell us that something is wrong, will then be present in that area because it is abnormal for what the dandruff is doing to the hair. And because of that, itching starts to take place, okay? So it's an uncontrollable itch due to the inflammatory conditions there, all right? And there's many different things you could use as it relates to getting rid of the dandruff. There's actually a shampoo, which is a antifungal, and the name of it is called Keto Plus, all right? You could get that in pharmacies as well. And that will actually help to get rid of the dandruff very quickly. And in addition to that, at nighttime, when you're going to bed, you can also use things like organic cold pressed coconut oil. And coconut oil is actually antimicrobial, antibacterial, antifungal as well. So you could use that every night in the hair. Of course, you can always get, like a stocking cap or put things, tie the hair so that it doesn't go on your sheets and your pillows and all of these things. All right. So that is one of the things you could do as it relates to dandruff from a natural perspective. In addition to that, things like athlete's foot, which is another form of candida, all right, caused by candida albicans as well. You can also get yeast infections, all right, which is most common in women and can be easily present in women as well, not only via sexual interactions, but also by wearing wet clothing, all right, keeping on wet clothing for too long, also not having proper gut microbiome in the upper region of the vaginal area, all right? Now, as it relates to females, in the upper region of the vaginal area, it is supposed to be acidic. And for females that use cleansing agents in that area, it tends to alkaline the area and it throws off the pH balance. And that causes an overgrowth of candida. And that can cause a lot of discomfort in that area, redness, itching, and all of these things. All right. Now, if they were to go to the pharmacy or the doctor, they may give them antifungal medications to insert in that area. However, it isn't dealing with the root cause of the problem. It will only treat the symptomology, and the problem could reoccur again. Now, the problem lies in the gastrointestinal system. And one of the main strain of bacteria that female need is acidophilus. All right. So if you were to buy any probiotic, you make sure that it has acidophilus in it as well, because the acidophilus will add back acidity to that upper region of the vaginal area, and that will regulate the pH balance there again, causing the candida to go away. All right. And of course, it will also help with your gut health. So when you replenish and put back the good bacteria in the stomach, it will keep the bad pathogens under control again, as it's supposed to. All right. So that's a little tip of advice there for females as well, who are experiencing or have or would get yeast infection from time to time. All right. As it relates to the LOTA, you could use coconut oil in the skin as well. And of course, from an external perspective, but you also need to use probiotics to replenish the good bacteria as well. All right. Now, what kills the flora in the stomach is because of high consumption of processed foods. So canned foods, foods that are high, well, of course, dairy. All right. If you're using any cow's milk, that is another thing that depletes and kills the good flora. Antibiotics, as well as other medication, could also kill the good bacteria as well. The use of steroidal medication could also cause that issue as well. Okay. So those are the things that you want to limit. Of course, if a person has an emergency situation and they probably using steroid, as soon as that person comes off of those steroidal medication, of course, start using your probiotics to replenish your good microbiome so that you don't have any side effects or negativities as it relates to issues associated with that. All right. And of course, if you have any issue that is, arising there, we will treat you from a natural and integrated perspective so that you don't have to use those medication as it relates to steroids or any antibiotics and so forth as well. Actually, at Batson Associates, we have a natural antibiotic by the name of mineral silver. And silver is colloidal silver with minerals. And what it does, it removes any pathogens and bad microorganisms in the bloodstream and without damaging the stomach in that negative way as well. So if you're having any boils, if you have issues with rashes on the skin and so forth, it tends to get rid of all of those problems as well. Eczemas and psoriasis and all of these issues associated with the integumentary system, it also gets rid of those things as well. All right. And we actually have a discounted price on those items as well. We actually have a number of products at this particular time that is discounted. All right. So we actually have $25 to $50 off of all of these selected items actually, and that is our uterine plus, our women's formula, our inflammation formula, nerve restore, optimizer, vitamin C, blood sugar complex, mineral silver, super omega, and our prostate support for men. All right. And our contact number again for our branches, and we have 4 branches. Our contact number is 222-8261. That's for our Chaguanas branch, which is located on the 2nd floor of Money Talks building. Again, that's 222-8261. Our Daybay office is located on the corner of Ramsamoon Street and the SS Erin Main Road. And the contact number is 223-7515. That's 223-7515. Our St. James office is located on the main road of St. James in the Red Edge Mall. And that contact is 220-8113. That's 220-8113. And of course, our Tobago contact is 226-4553. That's 226-4553. And the Tobago office is located in Scarborough, Tobago, in the Triangle building. Again, this is Supporting Your Health Naturally with Stephan Vialva, consultant and blood microscopist at Batson & Associates. All right. One of the things as it relates to medication and antibiotics, now most doctors will recommend antibiotics if you have an issue and a suspected infection. And the thing with antibiotics is that because it's a controlled drug, you aren't supposed to use antibiotics just like that. And what you're supposed to actually do is, let's just say, for example, someone has a issue with their skin. So they have an infection on their skin. You're supposed to actually swab the area. You want to also incubate that bacteria and inoculate it on an agar. And you want to test that bacteria to see what bacterial family it belongs to, because bacteria have different families, all right? And for example, just train a little bit here. Let's just say, for example, you have E. coli, all right? And E. coli you tend to have in the colonic area, all right? If you have E. coli in any other area of the body, it is problems, okay? So bacteria, yes, they belong in a specific and respected area, but if it moves from one area to another that it doesn't belong, problem arises, okay? So with that being said, after doing the laboratory test as it relates to antibiotics, then you will have that conclusive report as to which type of antibiotics you need, and that will rectify the issue so that it doesn't be a prolonged amount of antibiotics that you have to take. Because you see, sometimes you are recommended 5 to 7 days course of antibiotic, broad spectrum, but the antibiotic doesn't work for that issue because it may not be as potent to get rid of the bacteria or pathogen. And of course, then they will put you on another 5 to 7 days. And the more antibiotic ingested is the more damage it will cause to your immune system, which and 70% of the immunity comes from the digestive system. So this is how important your gut microbiome is, all right? But the use of antibiotics will kill those good flora and bacteria and cause a lot of issues there. So if you have issues with your skin, you have reoccurring yeast infections and so forth, and you're using antibiotics, antifungal medication for candida and so forth for a lengthy period of time, what is going to happen is, and you're not using any probiotics to replenish the colony, it will reoccur and reoccur and reoccur again, and you will just be spinning up in mud. And of course, that is very depressing, and you tend to have issues with your self-esteem, especially if it's on the surface of the skin, having to go out into public and all of these things as well. All right. So with that being said, I will highly advise that persons, if they have those issues, gastrointestinal issues, you're experiencing any bloating, any gas, any flatulence very often, constipation, diarrhea, all of those issues as it relates to gastrointestinal health, I would recommend that you call our contacts that given and book an appointment. We also do consultations and the live blood analysis, and we will then recommend things accordingly based on the issues that you're having to be rectified from a natural and integrative perspective. All right. Moving along, also as it relates to the candida as well, if persons have any athlete's foot, all right, one of the things that you could do, if you have hydrogen peroxide at home, you can use like a hydrogen peroxide foot soak. So you use some warm water and you can use about 2 to 3 cupful of the hydrogen peroxide in that water, and you put your feet in and you soak your feet for at least 25 minutes to half an hour, and that will actually kill the candida on the surface of the skin. Of course, you also have to use probiotics to replenish the good bacteria that was lost. All right, and of course, you have to change your diet so the diet doesn't, so an unhealthy diet doesn't affect the gut microbiome going further to cause that reoccurrence of the problem again. Okay, also try to wear clean socks every day and also wash your footwear as often as you could to prevent any spreading of the fungus there as well. All right. I also want to touch on kidney stones. And kidney stones is one of the issues that is on the rise at this time. Based on my observation, doing consultation with persons on a day-to-day basis, I've seen a lot of people coming in with kidney stones at this time, and there are actually 4 different types of kidney stones. All right. 2 of the most common, however, is uric acid and calcium oxalate. All right. You also have cystine stones as it relates to the kidneys, and struvite, which is another type of kidney stone as well. Cystine is actually one of the rare types, and that can happen when a compound of cystine builds up and of different chemicals and cause or create some mass in that area there. And it could be very, very severe. Most times it can reach the condition of surgical procedure. All right. And no one wants to do surgery. And at Batson Associates, that's something that we also try to avoid people doing. Okay. So we give them proper advice and so forth to not have to go down that road to do any surgical procedure as well. Okay. Now, as it relates to calcium oxalate stones, and calcium stones tend to develop when a person is drinking or consuming dairy on a day-to-day basis, all right? Or using any type of medication from pharmacies as it relates to calcium. So by the use of coral calcium, calcium carbonate, and so forth, by using those type of inorganic forms of calcium, it tends to not break down properly, and those minerals get stuck in the kidneys and the medulla of the kidneys, and they cause of a stone to develop there as well, which is a renal calculi. Okay. So things like butter, cheese, that is another factor there as it relates to dairy. Those are things you want to eliminate from your diet so that you don't have these complications taking place as well. Drink a lot of water. A lot of persons aren't drinking enough water on a day-to-day basis. Sometimes persons come in and they drink like sometimes 2 glasses of water for the day, and that is highly, highly insufficient to replenish the body for what was lost. Now, there's 4 different eliminations of water, and that is via sweating, via urination, defecation, and of course, breathing due to vaporization. And by drinking 2 bottles of water for the day, or even 3 glasses of water for the day, could never replenish the body for what was lost. So dehydration in that area is taking place. Not only will you develop a kidney stone, but you can also develop, you can damage the kidney overall as well, because other toxins that is supposed to be released will start to increase in concentration, like creatinine, uric acid could increase. You can also have issues in terms of proteins in the kidney at times as it relates to that as well. Hormones, all of these things will not be able to pass properly via urination, and that can cause some issues there on long-term effects on the kidneys there as well. And the kidney being a very delicate organ, you do not want the kidney to become affected, okay? And that is imperative, all right? Another thing that I also recommend for persons, and you could do this at home, just as a home remedy to keep the kidneys healthy, to disinfect and to keep the kidneys clean, is by using parsley. Now, parsley, basically what you want to do now, depending, in some areas you may get parsley in a large heaping set. So you can actually burst it into two. So you have two usage there. And one of the use you take, you boil some water, you hot some water actually, and you put in the parsley there, you wash it out, you put it into the pot, and you let it draw. And from there, you then bring it to room temperature, you pour it out in a glass bottle, and you refrigerate. And every day you're going to drink your water, you take a glass of that parsley water and you drink it as well. And that will actually disinfect and keep the kidneys clean so that you don't have these issues taking place going forward, but you have to maintain proper water intake. And that is important as well. All right. And of course, as mentioned, stay away from things like cheese, butter. You also want to stay away from any inorganic types of calcium, like calcium carbonate, coral calcium, and so forth from the pharmacies. All right, calcium caltrate is another one as well that is recommended to a lot of persons, saying that it will strengthen the bones, but actually it's causing more harm than good. Okay, because the calcium is inorganic, it isn't getting to go into the bone effectively. The bone is still becoming weak, and those deposits are staying in the kidneys and causing stones to develop in the kidneys. Can also cause you to get things like heel spurs, as well as cataract in the eyes as well. Okay, so as it relates to the kidneys, please drink a lot of water. All right, and you also have to change your diet. We will provide proper diet plan for persons who come into us to do consultations or the live blood analysis. So they will then be guided accordingly as it relates to that area as well. Okay. Another thing I want to touch on as well is posture. And in today's society, a lot of people, young persons, elderly persons, especially the elderly, but young persons are having issues with back pain, neck pain, spondylosis, scoliosis. They tend to have a lot of issues with their body alignment. All right. And you can also have issues with your alignment by just not only sitting improper, but also sleeping in a particular position for too long and putting the body under that strain as well. For example, sometimes you're walking down the road on the pavement and you misjudge your step, and that could actually put the body out of alignment as well, okay? As well as carrying load on one side more than the other. So for example, let's just say a construction worker, he's heading to work, but he's carrying his tools on one side of the body more than the other. That can cause an imbalance in the body as well in terms of his alignment. And what happens is, so let's just say this is the hip, and the hip is supposed to be level. Now, anytime the body is out of alignment, the hip will shift, all right? And you will have a tilt in the hip. And because of that, the sciatic nerve that is running across the hip area there, the hip bone, the pelvic area, will then be compressed. And that will cause some neurological disturbances. So you then tend to have pains shooting down the legs from the buttocks down, straight down to the calf, or even further. Some persons may experience, all right? And it is excruciating in pains. And what tends to happen is that because of neurological stimulation, in our muscles, there's motor neurons, and those motor neurons is responsible for contraction, eccentric and concentric movement of the muscles. So for example, let's just say we are going to make a fist. In order for us to make that fist, the motor neurons is responsible there, okay? Without proper motor neuron stimulation, the muscles have no use really. You see, because the muscle becomes very weak without proper neurological stimulation. It's just like someone who has cerebral palsy, all right? What tends to happen is because of their neurological issue, all right? The muscle has no use, so they probably on a wheelchair for that dependency because of lack of mobility and all of these things as well, all right? So it is imperative to maintain proper posture. If you have issues hereditary that you may inherit as it relates to spondylosis or scoliosis, I will highly advise that you can see a chiropractor, all right, to get the body aligned, all right, so everything will go back into normalcy again. And of course, you have to use things to nourish the nervous system. your B vitamins, your B1, your B2, your B5, B3, B12, B6, and so forth, all right, to keep the nervous system healthy. Now, all B vitamins, yes, they will target the neurological area in terms of nourishment, but they have different roles. So like B1, which is thiamine, that actually helps like with the eyes. It also helps with the gastrointestinal system as well, because your gut and your brain has a connection. It's called the gut and brain axis. All right. So let's just say, for example, a person is home and that person has to go out. Immediately, they tend to get that little anxiety, all right, and irritability. And that can cause them to have to run to the washroom before they leave to go to their destination outdoors, all right? So that is also because of the gut and brain axis. And by using things like thiamine, it actually helps to maintain proper stability there, as well as probiotics, which will prevent any high levels of flatulence and bloating and gas, and to help with proper absorption and to prevent the immune system to function properly as well. All right. So it is imperative as it relates to having proper neurological stimulation for many different functions. In some persons, they may have constipation. Not that they are not drinking enough water. A person could drink a lot of water. A person could have a lot of fiber in their diet. But because of the environment, it may not be as comfortable. Let's just say that person is on work and they don't like to use the restroom on that particular area. They tend to not have, or persons is around, the area is busy. They tend to not have that brain and gut access connection. So they tend to lose the urge or feeling to have a bowel movement or even to urinate at times. They can have that disturbance there. And that is how sensitive the body is. Okay. So I would highly advise that persons do a lot of stretching as well, okay, as it relates to the nerves. Even if you don't have any issue, particularly as it relates to scoliosis, spondylosis, which is curvature in the neck and loss of lordosis in that area. Scoliosis, which is actually loss of lordosis in the spine and curvature of the spine. I will highly recommend that you do a lot of stretching, a lot of decompression exercises. One of the things that you could do for the scoliosis, actually, if you can get like a pull-up bar, but you're not pulling up yourself, you're actually holding onto that bar and you allow your body to levitate in that area there, and that will decompress the spine and allow minerals from the blood to go back in between the bone and, well, like the vertebrae and cartilage and so forth as well, to nourish that area as well. Okay, so that is highly recommended. Stretching every morning, doing things like your deep breathing exercises, getting sunlight. And sunlight is something very simple. You know, you just have to walk outside and get your sunlight, particularly the morning sunlight, like around 7:30 to 8:30. You can get your sunlight while doing a deep breathing for proper conversion of vitamin D, which helps with your immune system, as well as it also helps with your joints as well. It keeps the bones strong. Okay, so those are just some little tips of advice that persons could do to maintain proper health and wellness as well. Okay. For persons who have issues with your spinal area in terms of scoliosis and spondylosis that is hereditary, all right, I will also advise that you have proper, like, you get a proper pillow to sleep on so that the neck don't be in an uncomfortable position to cause any severe issues, because that can lead to a lot of headaches. It can also cause you to get a lot of spasms running into the shoulder and so forth as well. It's very sensitive, okay? Of course, at Batson Associates, we have a wonderful product by the name of Nerve Restore, and that product actually helps to maintain proper neurological stimulation. It helps with anxiety, it helps with stress, it helps you to sleep as well, which is another thing a lot of persons have in society today. Okay, outside of work, persons have issues sleeping. You know, in terms of their shift jobs, it affects their sleeping pattern and so forth. And for some persons, they actually go to bed very late on a day-to-day basis, and that could actually change their circadian rhythm. So they tend to, if they usually used to go to bed at 10 and they start going to bed at 12, only until 11:30 or 12, then that person will start to feel very sleepy again. Okay. And that is something you don't want. You actually want to go to bed by 10 p.m. as an adult. So if you wake up at even 5 or 6, you will get your 7 to 8 hours rest there, which is important for you to start the day. Because if you don't sleep properly, what is going to happen is that neurotoxins is going to stay in the brain. The brain will not get to drain neurotoxins properly because the body actually helps to detoxify and do its repairs and so forth when we are sleeping every night from from the tissues to the cells, the nervous system, the gastrointestinal system. Everything is at work to repair, to function the day after for proper functionality and wellness there. And if you don't sleep properly, the neurotoxins will not be able to drain properly, and that can cause brain fog. So the next day you wake up, you're not attentive, you're not sharp with your memory, you tend to forget certain things, you just want to go back and rest. All right. You tend to also have issues with headaches. You get a lot of headaches. You can get lightheaded feelings, all right, due to lack of oxygenated blood to the brain, which will also affect the nerves in addition too. So those are some things there that you have to be very mindful of. All right. And again, for persons who have those issues, I will highly recommend that you can come to Batson Associates either to do a consultation as well as our live blood analysis so we can guide you accordingly in that area. And again, our contact number for our branches, which is the 4 branches that we have, is 222-8261. That's 222-8261. And that's our Chaguanas branch, which is located on the 2nd floor of Money Talks building in Montreal, Chaguanas. Our Debe office is located on the corner of Ramsamud Street and the SS Erin Main Road. And the contact there is 223-7515. That's 223-7515. All right, our St. James office is located on the main road of St. James in the Red Edge Mall. And the contact there is 220-8113. That's 220-8113. And of course, our Tobago branch is located in Scarborough, Tobago. And that is located in the Red Edge Mall. I'm sorry, in the Triangle Building in Scarborough. And the contact there is 226-4553. That's 226-4553. For persons who now tuning in, my name is Stephan Vialva, Senior Consultant and Blood Microscopist at Batson Associates. And this is supporting your health naturally. All right. And as mentioned, some of the topics that I would have already mentioned is as it relates to poor gastrointestinal health due to foods that persons are consuming on a day-to-day basis in the world today that is highly processed, has a lot of refined sugars, gluten, as well as a lot of foods that also has antibiotics injected in them, like things like beef and so forth, even chickens, all right? So that is imperative as it relates to affecting your gastrointestinal system. You always want to maintain and consume a lot of green leafy vegetables, which is a prebiotic for your healthy gut microbiome, all right? And that is actually like a food for your gut health as well, okay? And that could prevent you. Of course, some vegetables, like the cruciferous vegetables, can cause you to get some gas and bloating building up there. Not everyone may experience that, and that would be things like cauliflower, kale, as well as broccoli tend to provide that issue there for you. Some peas and beans as well. And of course, this doesn't happen to everyone, but if you're having any negativities in that area, I will highly advise that you minimize your consumption of those things that is causing that negativity, probably until you rectify the issue by coming to us, and we can then give you specific foods to use at that particular time to heal back the stomach and to wean yourself off of any habitual patterns that you are engaged in, like eating and drinking at the same time or eating your foods too quickly and all of these things as well. All right. One of the things that I also want to mention as well is as it relates to the integumentary system. And the integumentary system, which is the skin, and the skin is basically made up of different stages. So the first layer of the skin you have is your epidermis, which is where the innate immunity relies, which is the good bacteria on the surface of the skin. And then you have your dermis, which is the second layer, all right? And then you have the hypodermis, which is a third layer, which is your adipose tissue, and that is your fatty tissue there, all right? Then you have your fascia, and the fascia is basically made up of collagen proteins that allows the muscle to glide on the surface there so that you don't get any restriction and tightness. And of course, the last in the integumentary system is your muscles, all right? Now, the fascia, which a lot of persons don't know about, sometimes you're getting a lot of pains, and it's because of the fascia causing the pains due to lack of mobility. And the person probably have a sedentary lifestyle. They aren't exercising or doing any physical activity. They aren't doing any stretching and so forth. And that can cause some pains and restriction there. So sometimes you just move the shoulder and you tend to get a lot of pains there, okay? It's nothing of severity to that extent, but I will highly advise that you can always get like a massage, all right, to loosen up the fascia again. There's actually something called a foam roller that you can get like a yoga mat, and you lie on your back and you tend to roll back and forth to loosen the fascia within the muscle area there. So you tend to have proper flexibility. If you're doing strength and conditioning training, you tend to have full range of motion for the muscle fibers to extend and have that contraction, concentric and eccentric movement in that area as well. All right. And in order to take care of the integumentary system, of course, you have to hydrate the body properly. Okay. So when you sweat, you tend to remove toxicity. And of course, some persons, if they have high levels of toxicity in the body, they tend to get flare-ups on the skin, like rashes and so forth, and the skin eczemas, etc. And that is a clear indication that they need to do some detoxification. At Batson Associates, one of our detoxification processes is where we recommend something called, it's a tea actually, by the name of Santulan. And Santulan is a 7-channel detox. So it cleanses the liver, the skin, the respiratory system, the lymphatic system, and so forth. And that actually helps to minimize the amount of toxicity being released from a person. So even if you sweat, you just sweat to remove toxins in a healthy perspective, but you don't get any flare-ups on the external aspect of the skin as well, okay? Proper moisture in the skin is very important. Of course, if you have oily skin, you don't want to use too much oils on the skin as well, or anything that has a lot of chemicals, okay? Persons who put in things like perfumes, colognes on the skin, because of sensitivity there, you can get a lot of absorption taking place in the skin, and that enters into the bloodstream. And that is chemical exposure, which we could also see in the live blood analysis that we would perform at Batson Associates. Now, what happens with chemical exposure is that when it enters into the body, it actually changes the chemistry of the cell. So the cell tends to change shape, it becomes misshapen. And because of that, the hemoglobin inside of the cell, which is the pigment and protein that traps oxygen, will then tend to decrease, okay? Because there isn't enough, the cell doesn't have the biconcave shape anymore, which is that circular shape. It is misshapen, so it looks more or less like a jigsaw puzzle. So the hemoglobin has challenged there to absorb that concentration of oxygen. And if there's high quantities, persons could then have things like shortness of breath. Of course, you can get things like fatigue and tiredness and so forth as well. So all of these things, the live blood analysis could indicate. So sometimes you may not have an issue, all right? But by just coming in and get a live blood analysis done, it can tell you that, okay, something is wrong here. So we will then recommend specific things to remove and prevent that issue from worsening, all right, to maintain proper health and wellness, okay? As it relates to the Santulan, we will highly advise persons to drink a lot of water as well. for the event that some persons may not drink enough water. And what tends to happen is if you don't drink enough water and you're doing any cleansers, you tend to have something called a healing crisis, which is where the body tends to have negativities and flare-ups on the skin. You may get some diarrhea, you may get some sensitivity in the gastrointestinal system, vomiting, and all of these things could appear due to that healing crisis. Okay, it usually don't last very long. Not everyone may experience a healing crisis, but it tends to last at least sometimes 1 week, 2 weeks maximum. Persons may have some challenges there. So in prevention of that, we always recommend persons to drink a lot of water on a day-to-day basis, so that when they start doing the cleansing, there isn't a high concentration of toxicity in the body as well, especially for persons who are constipated. You have to drink a lot of water so that you don't experience that healing crisis when you start using our Santulan product. All right. The Santulan is actually $100 per pack, and you will get it at all of our branches, Tobago, Chaguanas, Stevie, and St. James. And we will actually give you guidance as to how you should prepare it. And one pack will actually give you a week supply. So you use at least 4 packets as a course to complete that cleansing aspect there. And after that, you can take a little 4 to 5 months after before you do any cleansing again, because you can't over cleanse as well. Okay, it could affect your gut microbiome there on a healthy perspective. So you always have to do everything within balance as it relates to the human body. Okay. With that being said, as I mentioned in the gastrointestinal system there, leaky gut syndrome. And leaky gut syndrome is something that is very common in today's society because of the foods that they are ingesting. All right. So inside of the gastrointestinal system, all right, the small intestine is coated or lined off with epithelial cells. And these epithelial cells is actually used as a barrier, all right, before the nutrition is being absorbed into the bloodstream. Okay. But what tends to happen is if persons are using any prescription medications like antibiotics or steroidal medications, if they're using any painkillers and all of these things, that will decrease and affect the environment of your gut microbiome as well as the gastrointestinal system. It damages the epithelial cells. So the epithelial cells that is supposed to be compressed now starts to have a little gap or opening because the junction in which is keeping that together, it damages the junction there. And that junction is basically a little connectivity there to keep the epithelial cells, tight. Okay. And when that opening takes place, toxicity that is supposed to be transferred to the colon to be excreted via defecation is then entering into the bloodstream as well. And of course, inflammation will be present because something is wrong. All right, it is abnormal, and inflammation will start to increase, and that will cause either constipation or diarrhea at times. Okay, most times you tend to experience diarrhea in this case. As soon as you have a meal, you tend to get bloated, you tend to get gassy, and then you have issues with diarrhea, So, and that will cause you to become dehydrated as well due to the lack of liquids as well as electrolytes there. Electrolytes could actually become imbalanced as it relates to diarrhea as well. So things like coconut water, which is the most healthy a natural way to ingest natural electrolytes, is highly advised there. Some persons may use things like G-salts, Lucozade and Gatorade and all of these things, but those things have a lot of refined sugars, and it will only cause more harm than good because the bacteria will die in the stomach even further, and that will cause things like immunocompromised situation that can lead to things like autoimmune diseases like Crohn's disease, or you can even get ulcerative colitis as well. Ulcerative colitis is basically where when a person goes to defecate, they tend to have a lot of bleeding taking place as well, and that can cause you to become anemic, which is not a low blood count, but a low hemoglobin, all right? So of course, if persons have those issues out there and they're listening to the program at this time, supporting your health naturally with Bats and Associates. My name is Stephan Vialva. All right, feel free to call this contacts, which I will call out for you shortly. You can book an appointment to get your consultation done. You can do your live blood analysis. Of course, when you call the clinic, they will give you the necessary costing of those tests and so forth as well. And based on availability, we will book you accordingly as well, so we can guide you accordingly as it relates to rectifying those issues. If you have issues with ulcerative colitis, or any bleeding disorder, blood disorders, and you have your CBC tests with you that you would have done before, you can always bring it. So going forward, after being on the program with us, we can then recommend another referral for you to get another CBC test done to see your progression levels there as well, in terms of building up the blood count and so forth as well. All right. Now, the CBC test is a very important test. Even if a person doesn't have a particular issue that they are aware of as it relates to a blood disorder, with your white blood cells, with your red blood cells, with your platelets, and so forth, I would recommend that you get it done every year, just for early, to prevent anything and early detection. So once everything is well, you just maintain a healthy lifestyle, eat on time, eat a lot of nutritious foods, alkaline-based diets, which is vegetables and your provisions and all of these nuts and greens, your fruits and so forth. And of course, exercise and physical activities, and the body will do the rest. All right. Our contact number again is 222-8261. That's 222-8261. And that's our Chaguanas branch, which is located on the second floor of Money Talks building in Montreal, Chaguanas. We also have our daily contact, which is 223-7515. That's 223-7515. And our daily office is located on the corner of Ramsamud Street on the SS Erin Main Road in Debe. Our St. James branch is located on the main road of St. James in the Red Edge Mall. And the contact number is 220-8113. That's 220-8113. And of course, our Tobago branch, the contact is 226-4553. That's 226-4553. And our Tobago office is located in Scarborough, Tobago, in the Triangle building. All right. So as it relates to some of our services, besides the live blood analysis, there's a scan that we offer, which is one of the packages inclusive with the live blood analysis together as a package. And you also get a complimentary foot detox as well. So I will highlight as to what that scan pick up, as well as what the foot detox does. Okay. Now the MRA scan, which is a magnetic resonance analysis. It's not an MRI. An MRI is for imaging, actually. All right. So you tend to see any issues with the skin, any tissues, and all of these things you can identify from an MRI. But the MRA is a magnetic resonance analysis. And basically what it does is basically where you hold a magnetic probe in your dominant hand, which releases different frequencies to your organs and cells, so we can then get an indicator as to what area of the body you need to pay attention to. So some of those areas, and it is not a diagnosis, but it is an indicator, all right? So it gives us a reference range as to if it is as 1+ or 2+ over the reference, or under the reference in that case as well, in terms of deficiencies and abnormalities. So for example, let's just say we picked up the cardiovascular system. The cardiovascular system could show things like issues with persons not exercising frequently or not exercising at all. All right. It will give us indication as well if you have lack of elasticity in the arteries, okay, which can cause hypertension, which can cause issues with your circulatory system. All right. the inability of the arteries having to expand can cause a lot of pressure building up there, which is what hypertension really is. So when blood enters, okay, so the arteries has the ability to expand, and when blood enters, if it don't have enough elasticity to maintain that volume of blood or pressure, it will only increase. So when the blood hits the artery walls, you get an elevated systolic, which is the top figure on the blood pressure machine. And that can fluctuate due to stress, which is secondary form of hypertension. If you are not sleeping properly, all right, all of those things. Of course, anxiety as well will cause that false positive reading there as well, and even white coat syndrome, okay, due to anxiety. Sometimes you go to the doctor's office and, of course, you don't want anything to happen with you. So you tend to start overthinking and the heart rate will increase. And then you start having issues with your blood pressure reading there. It tends to elevate as well. But those are secondary sources of hypertension. But primarily, it's basically a circulatory issue caused by lack of elasticity and lubrication of the arterial vessels, okay? And of course, you want to start nourishing the heart as well. One of the main things that the heart uses to maintain proper muscular function is CoQ10, which is coenzyme 10. And CoQ10 is one of the enzymes that keeps the heart strong. But you see, when persons are aging, the CoQ10 levels naturally starts to decrease. And because of that, the heart muscle becomes weaker and weaker and weaker from a natural perspective. But of course, you have to use supplementation because you won't get everything from food, especially in the world today where everything is genetically modified and so forth as compared to long ago. You have to use some sort of supplement to supplement the area there to maintain longevity in that area as it relates to the heart muscle. For persons who are using statin drugs, like rivastatin, simvastatin, well, Simlo, Forte for short, and so forth, you tend to have issues there with your coenzyme 10 because statin drugs actually help, it actually decreases in a negative way the coenzyme 10, and that gets the heart muscle very weak. Now, doctors will recommend that statin drug for you for cholesterol levels to regulate, but it actually causes more harm than good eventually. And of course, when the heart muscle becomes very weak, then you will have to do things like using a pacemaker to regulate the heartbeat there as well. All right. So just a tip of advice there as it relates to that. Of course, you can't come off a medication just like that if you have dependencies on those medication, depending on the severity of your issue. So I highly recommend that you book your appointment. You visit us at Batson and Associates so we can guide you accordingly. We will go through all medical reports, recommend proper diet plan for persons, all right, and give you very thorough advice as to what you should be doing, what you should refrain from, all right, and also use different diets as it relates to issues that is tailored for that particular problem as well. Okay, diabetes is another thing that creates circulatory issue, all right? Because what happens is with diabetes, it tends to coagulate the blood cells. And coagulation basically means sticking up the blood cells. So the cells then it doesn't have the ability to go through the arteries as it's supposed to. So volume and pressure will increase in the arterial vessels. In addition to that, if you are consuming, let's just say a high sodium diet, so in the Caribbean, persons start using, well, they tend to use a lot of golden rays, which is a type of butter, or even butter, blue band butter, and all of these things. You tend to have issues there as it relates to that sodium concentration, and that can cause restriction in the arteries. So the arteries don't have the ability to expand to intake or that accumulation of blood flow there as well. And that can cause hypertension as well. All right. So it is imperative to know what type of sodium to use. I highly recommend persons to use pink Himalayan sea salt. All right. Because the sodium levels there are very low. So you don't have any negativities as it relates to your blood pressure or on the kidneys and all of these things as well. All right. Of course, everything as it relates to life and health, you have to maintain within balance. You can't overdo, you can't under intake anything, and you can't over intake anything. You have to maintain proper balance there as well, and the body will do the rest. Okay. For example, some persons they tend to, because something is healthy, let's just say turmeric, ginger, and these things, they tend to want to drink those like ginger tea and so forth, or even garlic tea on a frequent basis because they have a lot of good properties. But you see, if you do so, you can end up with negativities. If you use garlic too often, it could drop your blood pressure. So this is why I highly recommend persons to do CBC tests as well, outside of the live blood analysis, to make sure that their red blood cells and everything is within range so that you don't have any complications there on a negative perspective. Ginger is one of the things that could also affect your blood pressure as well. All right. Moringa, if you don't have proper dosage, as it relates to those things, it can either drop your blood pressure too low. Now, those herbs have a lot of benefits for the human body. But if you don't have proper balance in terms of what you're ingesting and you're using, you're overusing those things on a frequent basis, some persons probably they like to add different things together as a little concoction. So they may add some ginger, with some moringa and some turmeric and all of these things because they want to get healthy right away, but it don't happen like that. The body takes time. Diseases don't even happen overnight. So you actually have to use those things in moderation and you actually space it out. So if you use moringa today, you can actually use ginger the next day. You can probably use some turmeric the next day. As turmeric is something that you don't want to use too frequently because it can cause thinning of the blood as well. And that can cause issues with your renal function. It can damage the kidneys. It can also cause you to have cardiovascular issues as well. You can develop things like heart murmurs due to lack of that concentration of blood flow in the heart. All right. You can get palpitation of the heart and so forth as well as it relates to those issues. So it is imperative to be guided accordingly as it relates to what you're ingesting, your foods, your nutrition. I know a lot of persons they may look at the internet and so forth to get information as to certain things, and education is and knowledge is power. All right, and I highly support that. But there are some things that could mislead you. So it is also important to always come to persons that are specialized in those areas to get proper guidance there as well as it relates to those things. All right. Again, this is Batson and Associates supporting your health naturally. All right. My name is Stephan Vialva, senior consultant and blood microscopist. And again, I want to mention our discounted products that we have at this particular time for the Christmas season. All right. We actually have $25 to $50 off on selected items. And those items are our Uterine Plus. A Uterine Plus is basically used for, is a detoxification for the uterus lining for persons who, for women actually, who have fibroids, if you have any thickening of the uterus lining and so forth as well. Uterine Plus is actually very good for that area. All right. Women's formula, our inflammation formula, our Nerve Restore, which is an amazing product for sleeping, for anxiety, also for any stress on the body as well. It's actually one of the products that I use on a day-to-day basis, to maintain proper functionality of cognitive health and all of these things as well. Okay, to keep your memory sharp and on cutting edge as well. Optimizer, which is another amazing product as well that helps to reduce inflammation from the brain and in the eyes. So for persons who have visual issues like cataracts, glaucoma, it actually helps to nourish the nerves in that eyes. Now, glaucoma is one of the things that sometimes the pressure in the eyes has reduced, okay? But because the problem was prolonged for so long, it can damage the neurological area there, and you will still have some issues with visual impairment. So you actually have to nourish the nerves, which is what the optimizer does. And also you have to maintain proper water intake You also have to start exercising and doing a lot of physical activities to drain the fluid that is building up behind the eyes as well. All right, so those are very important. Okay. And there are other things that we could recommend based on the severity together with the optimizer to nourish the nervous system there. All right. So again, our products that is on a discounted price at this time is our Uterine Plus, our Women's Formula, our Inflammation Formula, our Nerve Restore, our Optimizer, Advanced C, which is vitamin C, blood sugar complex, silver, super omega, and prostate support for our men's health. All right. Again, our contact number for our offices is 222-8261. That's 222-8261. And that is our Chaguanas branch, which is located on the second floor of Money Talks building in Montreal, Chaguanas. Secondly, we have our Davie branch, which is located on the corner of Ramsamud Street and the SS Erin Main Road. And the contact number there is 223-7515. That's 223-7515. Our St. James office is located on the main road of St. James in the Red Edge Mall. And the contact there is 220-8113. That's 220-8113. And of course, our Tobago office is located in Scarborough, Tobago, in the Triangle Building. And the contact there is 226-4553. That's 226-4553. And again, this is supporting your health naturally. All right, my name is Stephan Vialva, Senior Consultant and Blood Microscopist at Batson and Associates. So far we have covered posture as it relates to lordosis. And again, lordosis is the natural curvature of the spine. So in the neck area, we have a specific curvature that has to be maintained. And also in the lower spine, you have to have a particular maintenance of lordosis there as well, because anytime the spine has curvature, you tend to end up with sciatic issues, lower back pains. You can have bulging of the disc, pinched nerve, slip disc. All of these things can happen because of that one problem. Now, some of these issues are hereditary, all right? And of course, most of them today is because of poor posture. But sometimes the persons are holding their phone, their neck is in that downward position for too long. They put in stress on the neck there, it can affect your lordosis. So what tends to happen is, if the vertebrae is supposed to be like this and your neck is bent in that position, it's going to touch. It's going to touch. And because of that, the nerves will be interrupted there. So you have lack of neurological stimulation there. And that can cause a lot of issue as it relates to your motor neurons. You can have a lot of headaches, especially if you're having spondylosis. All right, headaches, dizzy spells. You can then start developing things like vertigo, which is where you start losing your balance and equilibrium. So sometimes you walk in the road or on the pavement or even in your home, and you tend to start drifting more on one side than the other. All right. It have different exercise that we can recommend for you by visiting our clinic. In addition to that, we will have to recommend things to nourish the nervous system. And if it is of severity, we will then recommend. We also have one of our doctor by the name of Dr. Budu. He's actually a chiropractor and physiotherapist. So we will recommend persons to go by him if they have any musculoskeletal issues to rectify the issue from that perspective. Whereas we will recommend things from a nutritional perspective, like our inflammation formula, which is an amazing product that reduces inflammatory responses. And again, inflammation belongs in the human body. The persons tend to want to get rid of that inflammation, but you can't. You can only regulate it. It belongs there, and it's there to tell us that something is wrong. So for example, if I were to just accidentally hit my hand on the edge of a desk, all right, by walking, it tends to get tender and swollen and red and inflict pain. And that is an indicator to me that something is wrong in that particular area. So you can't get rid of inflammation completely, but you have to regulate it, okay? And the inflammation formula does just that. Of course, you have to maintain proper eating patterns, all right? Eating the right foods, your whole foods, using things like wheatgrass, which is another product that we carry at Batson Associates, our liquid chlorophyll, all right? Those are things that will provide you with proper maintenance of your blood sugar, of your blood pressure from a natural perspective, of course. I will not, if you have issues with hypertension or low blood pressure, actually, and you want to use those things, I will actually recommend that you be guided accordingly by visiting us, at least for a consultation, so we can guide you and let you know the dosage in which you should use it, and how to build back up the blood count and all of these things as well. But the wheatgrass actually helps with proper mineral intake, and minerals are actually used to absorb vitamins as well. So minerals are actually even more important than vitamins, okay? And you can also get minerals from sea moss, which is also very good for the joints. Sea moss actually carries 95 to 97 different trace minerals for the body to function on a day-to-day basis. However, again, as mentioned before, dosage is the problem. Now, you don't want to use a heaping set of CMOS at once. Will not cause any negativities. What happens is that the body will only absorb what it can, and the rest will go to waste. So if you have to use CMOS, the dosage actually is 2 tablespoons daily. You can actually use 1 tablespoon in morning around 10:30 as a brunch period, and that will provide you with that nutritional aspect there. And in the evening time, if you want to have another smoothie, you can use your CMOS as well, that 1 tablespoon in addition to. You can also use it in water just as it is. You can have some warm water or room temperature water, and you add, if you want to use the 2 tablespoons at the same time, that is not a problem. If you want to use it separately, that is not a problem as well. But do not surpass the 2 tablespoons. Otherwise, you'll just be wasting your CMOS there, because the body will only absorb what it could, and everything else will go to waste. All right. So that is a little tip of advice there for persons as well. A lot of persons, they don't really know that. So they tend to, put a heap in set because they know it's something very good for the body, and they just want to feel better. They want to maintain proper joint health and all of these things as it relates to the cartilage and so forth as well. But you have to do the right thing so the body could function the right way as well. Okay. Um, Sleeping is another thing, as mentioned before, as it relates to your posture. So you don't want to lie down on your belly, on your stomach, because that actually puts stress in the lower region of the lumbar in your spine, and that causes a lot of back pains there. All right. And even pinched nerve could also develop in that area as well as it relates to that. So the best way to sleep is actually on your left side, but not on your shoulder. Because if you sleep on your shoulder, the distance between your neck and your shoulder, you're going to have that neck tilted down there, and the sternocleidomastoid, sorry, which is the muscles in the neck, will actually go under strain, and that will affect you negatively there. That can cause stiffness of the neck and so forth. Or even if you're doing that repetitively, it can cause you to have issues with the vertebrae as well in the neck area there as well. So the best way to sleep again is on the side, but you actually want to sleep more on the chest area. Okay, so you can actually pull one of the legs upward in that bending position, and you can use like a pillow right under that area there as well. 1 feet extended fully out, one leg bended, and you on your side on the chest area. And that is actually one of the best ways to sleep. The reason why it is recommended on the left side is because of the stomach and so forth. And also, if you are, let's just say, for example, you were to puke, all right, or having any frotting taking place due to any issues that you may encounter, or gastrointestinal issues, you can actually, the fluid can actually escape without choking you if you were to lie on your back, okay? Not only that issue as well, but if you lie on your back, that tends to cause a lot of snoring, all right? So the persons who lie on their back at times, I always use some elevation as it relates to pillow there, not too high, all right, but also not flat, because that will cause the tongue to drop in the trachea, and that will block the airway there. And the trachea, for persons who are not familiar with that term, is basically what we call the windpipe. So it tends to block off there, and that will cause issues there with your breathing. You tend to have that gasping sound there, all right? And of course, lack of oxygen can cause other complication as well. Remember, the heart is at more of a resting point when you sleep, because the body is inactive, and you don't want to, have that suffocation there as it relates to oxygen going to the heart properly to oxygenate the body and so forth as well. It can cause a lot of circulatory issues. And of course, the heart could have a lot of disturbances there as well. Okay. So with that being said, again, try to maintain proper posture. Try to sleep on the right side of, on the left side of the body, sorry. Try not to lie on your back, okay? As it relates to the kidney stones, as mentioned before, try drinking a lot of water every day. And to drink water, you don't want to drink water in high volumes, because what is going to happen is intracellular absorption will not take place properly. So what that basically means, let's just say you have a blood cell and you drink water in a large quantity, because most persons wait until they're thirsty to drink water. And what is going to happen is that in that large volume, the water will not have the ability to go inside of the blood cells. So the body is not hydrated properly still. And the water just passes through the system. You go to the washroom, you urinate, but the body is still dehydrated. All right? So the proper way to drink your water is by sipping. Do not wait until you're thirsty, because thirst is an indication of dehydration. So you have your bottle. Some bottles you may see is 2 liters. 2 liters is actually 8 glasses, and that is standard across the board for everyone. If you are engaged in physical activities, going to the gym or any cardio exercises and so forth, or even work that involves a lot of physical, from a physical perspective, you have to drink more water, of course, especially if you're outdoors and in the sun and these things, all right? Some bottles you may see have 70 ounces. That is also 8 glasses, sorry, which is 2 ounces, 8 glasses, which is 2 liters, sorry. So that is actually the required amount as a generalized consumption of water there for the masses, all right? But again, if you are engaged in any physical activities and so forth, of course, you will drink some more water in addition to, all right? So you want to sip your water, at least 2 to 3 mouthfuls, and you want to drink water apart, let's just say like every 5 minutes apart. Even if you're not thirsty, still take a sip of water as well, all right? And that will actually help to keep the body well hydrated, all right? It will allow the kidneys to function properly, the heart, your circulation, everything will function properly from that perspective. And with circulation, as simple as it may seem, those little blood cells there, all right? And the blood cells in the body is actually, in terms of quantity, is 35 trillion, all right? 35.7 trillion, actually. And 1 million blood cells could fit on the tip of a pinhead, all right? So that shows you how microscopic those cells are, all right? So you want to take care of them and give them the proper nutrition that they deserve, so they can do their job by transporting that nutrients, oxygen, water, hormones, electrolytes throughout the body as they were designed to do, all right? And not cause any dehydration, because when the cells starts to stick together, which is coagulation of the cells, and in the live blood analysis, it is known as rouleau, all right? That can cause the inability of the cells to move to other areas of the body, and that can cause tissues to start dying, which is called necrosis. So you tend to have discoloration of that area, especially in the lower extremity of the body first, because it's further from the heart. You can get pins and needle type of feelings, which is called neuropathy. You can also have issues with burning sensations, which is nerve damage as well, which is also part of neuropathy. And you can also get cramping, numbness, headaches, lightheaded feelings, all of these things just because you aren't drinking water as you're supposed to. All right. Constipation. All right. Those are things that will happen because of not drinking enough water. And of course, as mentioned before, I was supposed to highlight the gluten. And gluten is something that gluten is a protein molecule. So you will get gluten from flour consumption. All right. And in today's society, gluten is affecting a lot of persons. It's actually causing a lot of autoimmune problems, things like celiac diseases, all right, as it relates to the gluten intolerance there, it can cause a lot of flatulence, a lot of bloating, a lot of gas in the stomach area as well. And yes, one of the questions that persons always ask is, you know, their foreparents would have consumed things like flour before, and how if they consume it at this time, it's a problem. And the reason for that is because of adaptation. At that time, plants has the ability to grow, all right? So the wheat and all of those things had the ability to grow properly. And in addition to that, it didn't have any chemicals added like herbicides and pesticides and all of these things to the foods for that speedy growth process. So those four parents, yes, the gluten would have still affected them, but as time goes by, the body would have adapted and adjusted to that condition. So as time goes by, with these genetically modified food structures, and also they would start bleaching the flour and all of these things, it's affecting the body negatively. All right. So in today's society, because it's mass produced and flour is used across the board for many things, for pastries and cakes, and especially for this particular season that is approaching, which is Christmas. All right. Persons would use a lot of flour to make a lot of their delicacies and all of these things as well. So persons will start having a lot of issues there as it relates to that. So you could always use things like gluten-free flour, all right, which comes in like oat flour. And you can make your own oat flour at home, which is very, very simple. You can just get some old-fashioned rolled oats, you pour it into your blender or food processor, and you blend it dry, and it turns just like flour. So you can use that as a base of your flour there. Of course, you could use just a little handful of the white flour just for that binding process. And of course, you use a lot of, you could use your wheat, you can use flaxseed powder for that smooth consistency, or the seeds based on your likeness, chia seeds, pumpkin seeds. Some people even add cranberries to their bread and so forth, which is delicious. You can use all of those things to make your bread at home, but you actually want to minimize the intake of the flour as compared to the normal ratio. So normally persons will use wheat and those things, but in terms of the flour, it's a whole bowl of flour, and you will just use the wheat and those things as a little additive there to probably discolor and give a little fiber there. The flax seeds and so forth in small quantities as well, or even the oats, they will use sometimes in the flour as well. But you actually want to reverse it by using more of the oats or other forms of gluten-free flour like coconut flour, spelt, cassava flour, there's sweet potato flour as well, and even chana flour that you could use, and just a little bit of white flour just to bind and hold it together so that it can, have that texture still, all right? And the food, but it will be more dense as compared to having, normal white flour in that large quantity. Your products may not swell as much, okay? Because of the lack of the gluten there, because gluten, again, is a protein molecule. And what it does, it allows the flour to gain that elasticity and allows the flour to swell and all of these things as well. So you have, the bread or whatever you're making, the bakes and all of these things is more fluffy and light. But with the gluten-free flour, you tend to not have that consistency. So it's a little more dense, it's a little more heavy, and you tend to eat less, of course, which is a good thing, all right, as it relates to gaining a lot of weight and all of these things as well. Flour is also a refined carbohydrate. So when it enters into the digestive system, it actually breaks down due to metabolism and it converts into sugar. All right. So for persons who are diabetic, it tends to spike your glucose levels. And of course, for persons who are non-diabetic, it can cause a lot of harm there as it relates to gaining weight. So what happens there is that insulin, which is responsible for breaking down those sugars into glucose, for the body to perform as it relates to energy and so forth. Anytime your body is secreting too much insulin because of foods that you are ingesting, all right, you will start to gain weight because insulin is a storage hormone and that will cause you to gain a lot of weight there. And especially a lot of women have challenges with that because women have a lot of fat cells as compared to men. All right. So anything that they consume, especially if it's in their genetics where they are endomorph, all right, they tend to gain weight very quickly as well. Or if they actually have a low metabolic rate, if they aren't exercising and have a lot of sedentary lifestyles, all right, ingesting a lot of junk foods and not exercising frequently, those are things that will start adding on visceral fat to the body, and you will have challenges there as well. All right. So again, this is supporting your health naturally. My name is Stephan Vialva, and I am a consultant of Batson Associates and blood microscopist, a certified phlebotomist and medical laboratory assistant as well. All right. Just to call back those contact numbers there for you. Our contact number for our offices, well, for Chaguanas is 222-8261. That's 222-8261. And the Chaguanas office is located on the second floor of Money Talks building in Montreux, Chaguanas. Our Debe office is located on the corner of Ramsamud Street and the SS Erin Main Road. And the contact number there is 223-7515. That's 223-7515. Our St. James office is located on the main road of St. James in the Red Edge Mall. The contact number there is 220-8113. That's 220-8113. And the Tobago office is located in Scarborough, Tobago in the Triangle Building. And the contact there is 226-4553. That's 226-4553. This is supporting your health naturally. All right. It was with great pleasure to serve you this morning. Our family of Sky 99.5 FM. It's a great pleasure having me on this program here this morning. All right. I hope persons would, understand and grasp everything that I would have related this morning to them. All right. As simple as I could break it down. All right. Especially for the elderly persons out there. Don't forget, if you have any complications, any illness at this particular time, feel free to call our office, book your appointments for your live blood analysis, for your consultations, all right? So we can guide you accordingly as it relates to those issues that you're having at this time. For our social media platform, our Instagram Live, Facebook, as well as our YouTube and TikTok. It's a pleasure, all right? I do hope everyone have a blessed and enjoyable day and stay blessed. Thank you.